Hello everyone, I am Dr. Suneel Kaushik, Consultant Surgical Oncologist, American Oncology Institute, Hyderabad. How does lung cancer affect the respiratory function? So lung is the crucial part of the respiratory system in our body. The impure blood circulated from the blood is purified by oxygenation of the blood that happens in the lungs itself. So the lung cancer can compromise the respiratory system by causing obstruction of the airway passages, or sometimes the tumor by itself can reduce the lung function by impairing the oxygenation of the impure blood. Sometimes because of cancer that is infiltrating the bone or nerves, it can cause pain and discomfort. This by itself can reduce the lung function. Sometimes in advanced stages of the disease, fluid can accumulate around the lungs. This we call it as malignant pleural effusion. This also can compromise the lung function by impairing the lung expansion. How does secondhand smoking impact the likelihood of developing lung cancer? In general, smokers inhale part of the smoke that is generated and exhale most of it. This exhaled smoke, if inhaled by a non-smoker, it is called as secondhand smoking or passive smoking. This exhaled air contains all the carcinogens that are present in the smoke generated from these cigars. Therefore, secondhand smoking also increases the risk of developing lung cancer, apart from all other harmful effects of smoking, like increasing the risk of heart attacks and others. The increase in risk of lung cancer is about 20 to 30% in these passive smokers, and the longer the duration of exposure, the higher the risk. Prevention is by avoiding the exposure altogether. How common is lung cancer in women compared to men? Traditionally, lung cancer is more common in men compared to women because of the higher rates of smoking among the men. Lung cancer is the second most common cancer in men in our country, whereas in women it is the fifth most common lung cancer. About 10 in 1 lakh men and 4 in 1 lakh women are affected by lung cancer in their lifetime in our country. Lung cancer in women is attributed to the secondhand smoking or passive smoking, or environmental pollution and environmental radiation exposure. Can we detect lung cancer through a simple blood test? Smokers are at higher risk of developing lung cancer. In heavy smokers, we detect the lung cancer by performing a screening test called as low-dose CT every year, so that the tumor is detected in very early stages. However, the research is going on to identify a blood test wherein we can detect the proteins from the cancer cells in the circulating blood, so that we can diagnose the disease early even before it is detected on a CT scanning. Currently, this is not widely in use as a screening tool to detect the lung cancer in the heavy smokers. However, this test called as a liquid biopsy, wherein we detect the circulating tumor DNA or circulating tumor cells in the follow-up of lung cancer patients to prognosticate, to identify the recurred disease early even before it is detected on a CT or a PET CT scan.